Welcome to Heat Safety 101, a heat safety primer for health professionals. This presentation is sponsored by Healthy Climate New Mexico. Let me start with a brief introduction. My name is Matthews-Trigg, and I'll be your presenter today. I'm a founding board member of Healthy Climate New Mexico and a climate and health technical expert. I'm also volunteer faculty at the University of New Mexico's College of Nursing and an affiliate instructor at the University of Washington's Department of Environmental and Occupational Health Sciences. This presentation was co-developed and reviewed by clinical experts, Dr. Kate Weber and Dr. Emily Bartlett, to ensure that the medical content is accurate and evidence-based. I'd also like to acknowledge the Healthy Climate New Mexico Education Workgroup for their feedback and input that really shaped this presentation. Now we're going to dive into treating heat-related illnesses. To start, we're going to focus on heat stroke, the most severe form of heat illness and an acute medical emergency requiring an immediate 911 call. Recognizing the symptoms of heat stroke and taking quick action can save a life. Heat stroke is defined by a core body temperature of 104 degrees Fahrenheit or higher. That means if you don't have a thermometer, they will be hot to the touch. To recognize heat stroke, there are key neurological symptoms to look out for: loss of consciousness, irritability, confusion, delusions, seizures, or stumbling around. In babies and young children, look for limpness, inconsolable crying, refusal to feed, or appearing confused and disoriented. Oftentimes, people experiencing heat stroke have been described as appearing intoxicated or experiencing a mental health crisis. They may seem drunk or high, stumbling around and agitated. They may be delusional or passing out. These are neurological effects of extreme heat on the brain. Don't assume someone is only under the influence of substances. They may be experiencing a life-threatening heat emergency. It is the context that should be the deciding factor. Hot temperature exposure, combined with one of the listed symptoms, should warrant an immediate call to 911. Again, if a person is exposed to hot temperatures and they are experiencing any of the listed symptoms, first you call 911, and then, while waiting for help to arrive, begin rapid cooling immediately. Don't wait. A life may depend on it. Now let's talk about the gold standard for rapid cooling, ice water immersion. This is the most effective method we have for treating heat stroke, and understanding how to do it properly can save lives. Ice water immersion doesn't require ice necessarily, but the colder the water, the better the cooling effect. The goal is to rapidly lower the person's core body temperature as quickly as possible. Remember, time to cooling has significant mortality benefit, and there are no medications that can treat heat stroke without cooling the body first. With early cooling, survival rate can be as high as 90%. However, if cooling is delayed after 30 minutes of symptom onset, mortality rate can be as high as 80 to 90%. This is why your immediate response, recognizing the emergency, calling 911, and starting cooling right away, can literally be the difference between life and death. There is one critical safety consideration if you're to do ice water immersion. Protect the person's airway. A person with heat stroke may have altered consciousness and could be at risk of drowning. Someone should be supporting them to stay upright in the water to ensure that their airway is protected. There are certain resources you'll need for ice water immersion: a bathtub, an inflatable pool, a stream, or a large cooler, really anything that can hold enough water to immerse the person's body. And you'll need lots of water, and ideally ice to make it as cool as possible. This method works because cold water conducts heat away from the body much more efficiently than air. The large surface area contact with cold water creates a rapid heat transfer, quickly bringing down the dangerous core temperature that defines heat stroke and causes the symptoms. While EMS is on the way, this is the single most important intervention you can provide. However, in many situations, the supplies to do this, a tub for example, and enough water or ice, is often not available, and other cooling methods should be implemented if you don't have these supplies. If ice water immersion isn't possible, the second best cooling intervention is tarp-assisted cooling with oscillation, or TACO. This method is very effective if done appropriately and early, and is particularly useful in field situations where you don't have access to a bathtub, a stream, or large water container. The TACO method requires ice or very cold water to be effective, and here's how it works. You place the person on a tarp, you pour ice and water on them. 3 to 4 people pick up the sides of the tarp and then continuously oscillate or rock the tarp, rolling that person around in the ice water. This creates maximum skin contact with cold water while allowing for continuous water flow and evaporation. The key to TACO's effectiveness is the combination of conductive cooling from the cold water touching the skin and evaporative cooling as the water evaporates. The oscillating motion ensures that fresh cold water is constantly in contact with the person's skin, preventing the water from warming up against their body. You can see in the demonstration on this slide that this requires multiple people, typically 3 to 4, to execute properly. One person manages the water pouring while others handle the tarp oscillation. This coordinated effort creates a highly effective cooling system that can rapidly reduce core body temperature. The TACO method offers rapid cooling comparable to ice water immersion when done correctly. It's particularly valuable in outdoor settings, sports environments, or emergency situations where traditional immersion just isn't feasible. Remember, like ice water immersion, you still need to protect the airways and monitor the person continuously.
What would you do if you were out on the trail and saw a runner who was suddenly overcome by the heat?
Severe hypothermia dangers include seizures, brain damage, and even potentially death. Are you okay?
Heat stroke can happen while running, camping, or at any outdoor event. Luckily, a tarp and water is all you need to cool them down.
Let's roll her. We need to get her in this tarp.
Chris Sampson, an emergency medicine physician at University of Missouri Healthcare, helps us demonstrate the TACO method.
Now we need to put some ice on her and get water on her as well, and pick up the tarp.
TACO stands for Tarp-Assisted Cooling with Oscillation.
The TACO method is very important for people who you may encounter that are confused, unresponsive, or have passed out from the heat and will not wake up. These people often need rapid cooling in order to help save their lives.
If someone is unresponsive, get them onto a tarp. Pour water and ice on top of them. Then keep the tarp moving.
Most of your heat dissipation occurs on the surface of your skin, and by oscillating or moving the tarp back and forth and having that cold water get in contact with all portions of their body, you're able to get the heat off them in a more rapid fashion.
Think of this as a temporary cooling method. You still want to call 911. But taking action before the ambulance arrives could make a life-saving difference. From the University of Missouri, I'm Teresa Snow.
When ice water immersion and TACO aren't available, water plus fan cooling is your next best option. This method relies on evaporative cooling, which is the same principle your body uses naturally when you sweat. The technique is straightforward, but requires attention to detail. You want to wet as much skin surface as possible. This means removing clothing and applying water. If possible, have people not actively cooling the individual help provide privacy. When the person's skin is wet, you want to blow a fan on as much skin surface as possible to facilitate evaporative cooling. Position the fan to maximize airflow across their wet skin, and as the water evaporates, it pulls the heat away from the body, lowering the core temperature. This method works because evaporation is a highly effective cooling mechanism. When water changes from liquid to vapor, it absorbs a small amount of heat energy, the same reason sweating cools you down naturally. The key to success with this method is continuous application. You need to keep reapplying water as it evaporates and maintain consistent airflow with the fan. Don't let the skin dry out completely if possible. While this isn't as rapid as immersion or taco, it's still an effective cooling method that can make a real difference in lowering someone's core temperature during heat stroke. Most importantly, it uses equipment that's often commonly available, water and any type of fan, making it practical in many emergency situations. Remember, you're still treating a medical emergency. So again, you want to call 911 first before doing any of these, and you need to continuously monitor the person and don't stop cooling efforts until EMS arrives. Ice packs are not as effective as the other cooling methods we've discussed, but they're definitely better than no action at all. Ice packs should be combined with skin wetting to maximize effectiveness. If ice packs are used and you have enough to cover the entire body, the more the better. However, if you only have a few, prioritize placement on the person's cheeks, palms, and soles. The reason ice packs aren't as effective as the other methods is simple. Unless you're able to cover the person entirely in ice packs, you're really only able to cool small surface areas. When combined with other cooling techniques like skin wetting or soaking hands or feet in cold water, if you only have a small cooler, that's really better than nothing. And really, the goal is to use whatever resources you have to create as much cooling as possible. If you're going to be in a location where heat stroke is possible or even likely, such as outdoor events, sports practice, and other settings and hot temperatures, bringing the supplies like ice, water, tarp, fan, etc. is going to be much more effective than simply relying on what you have in the moment and trying to figure it out then. Increasingly, heat exposure is our new reality, and being prepared means knowing what to do and taking action when a heat stroke emergency occurs. This slide shows a basic decision algorithm for rapid cooling. It goes through all the quick decision factors we previously discussed. This will be available on the Healthy Climate New Mexico webpage for you to download. Now, let's talk about other heat-related symptoms that do not require rapid cooling interventions. Dizziness, rash, feeling weak, feeling sick, or briefly fainting are not, in and of themselves, an acute emergency. However, they are an indication that someone should get somewhere cooler and drink water. If these symptoms persist or get worse, they may need emergency care. Also, be on the lookout for heat stroke symptoms to develop, as people can go from these seemingly mild symptoms to heat stroke, especially if they continue to be exposed to hot temperatures. On the bottom of this screen are some non-heat stroke emergency symptoms that do require seeking emergency care right away. These include profuse vomiting, difficulty breathing, prolonged feeling that the person is going to pass out, or urine that is brown, Coke or tea colored. These symptoms could indicate serious complications, such as severe dehydration or kidney damage, that requires medical attention right away, but again, does not require rapid cooling techniques that were previously discussed. When in doubt, you want to err on the side of caution, and remember, mild heat symptoms can progress to heat stroke quickly, especially in vulnerable populations. Thank you for your attention and for taking the time to learn about heat safety and heat-related illness prevention and treatment. The information we've covered today can save lives. Remember the key takeaways. Each of us has a role to play in protecting people from dangerous heat. For additional resources, ongoing training opportunities and awareness events, the latest guidance on heat safety, or to get involved in health professional advocacy, I encourage you to visit the Healthy Climate New Mexico website. You can also reach us directly at info@healthyclimatenm.org with any questions or concerns. The QR code on the right will take you directly to our website, where you'll find the additional heat safety related resources. As we've discussed, dangerous heat is part of our collective future. The time to prepare, both individually and as communities, is now. Thank you for being part of the solution and for your commitment to protecting the health and safety of all New Mexicans.